Now, I'm not sure whether I'm gonna have to go through all of the slides that you were going to be presenting to get to that. So let me just check what way are we pressing this one. No? I just interlude song. One moment, please. So, as Mark has mentioned, we are the team from Ligantic, and we have been partnering with Alive and the Prader-Willi Research Foundation Australia to bring to life some of the concepts that Mark was talking through there. Will it now work? Maybe. There we go. So you'll see some of the team that you're... I'm having technology troubles, which is, there we go. Some of the team that you'll see that have been working on this challenge with us, you'll recognise. So we've got the lovely Kathleen and Di, Mark, who you've just heard from, and also Tim Beaver, who's not here today. But from the Ligantic team, I introduced Mark Kohler at the back there, who's our CTO, and Carmel Price, who's hiding all the way at the back as our COO, and my name's Stef Kohler. And we really came together about 12 months ago to talk about how might we harness the emerging tech to support the PWS community. If I could. Is it the green button? I'm pressing all of the buttons at this point. And so that's really how we at Ligantic start to think about the application of this new emerging technology. How are we connecting it with humans and the challenges that we've got out in the world that were previously unsolvable, that we can now do this. And we came up with 2 clear objectives for this first use case that we wanted to tackle. How might we build a digital health assistant that would improve the well-being, social and economic outcomes for patients and families with rare diseases such as PWS, whilst simultaneously reducing the medical system, cost to the medical system through preventative care, improved access to timely and trusted information, and multiplying specialists' impact. But all of that all starts with a single step. That's a really big journey and idea to go on. And Mark's really great at painting the idea of what's possible. So we really wanted to synthesize this to something that we could action quickly and we could get some iterative value out into the community. And so we started with, can a chat interface, augmented with Prader-Willi context and information, and a human-in-the-loop expert clinician review, unlock easier access to information for carers? And so that's where the Prader-Willi clinician and family pilot started. We brought together 7 carers and 4 clinicians, some of which are in the room, so thank you very much. And we went through a process. First, we ingested 64 documents that had really trusted information around the Prader-Willi syndrome. And throughout the 2-week pilot, those fragments were returned or augmented in the responses 921 times. We did ask Kath to find us some curious people, and by golly, you did, because over those 2 weeks, we had hundreds of chat messages come through that we were able to work through and validate. Of those chat messages, 10% of the chat responses had feedback, either provided from the clinicians or the carers that were responding to this interface themselves. We also had some key learnings during the pilot that we had originally designed it for the clinicians to be able to provide feedback only, but we unlocked that there's so much lived experience in the carers that we were working with that we also wanted them to be able to provide feedback on how the responses were coming through. And during this process, we generated 81 clinician-approved responses. So those were responses to questions that came through that were approved. The clinician said, this is exactly what I would have responded, or how they would tweak it to be useful. And so in that 81 responses, that sounds like a smaller number, but those are continually reused responses that helps us to improve that system. And so here's a quick look at what it looks like on the chat experience front. We've got a threaded RAG-enabled experience that you can come and have a look at in the system. We've got it running live, so come and have a play around with it. And we've got that feedback functionality interface that I was talking through. We've also got the clinician and administration review. So the Ligantic platform has a built-in automated administration section, so you can govern and introduce this responsibly. But one of the most important responsible elements that we put in was a human-in-the-loop expert review that fed the context for the RAG conversation, but also enabled the clinicians to continue improving the information that we had available. But what were the key learnings that we took from this pilot and that we're continuing to go forward? Well, the key learnings that we took away were some of the quotes from the pilot. This would remove the current time and stress for parents, that this could provide immense value, that this is more than just an AI tool, it's a lifeline and could replace hours of information searching, that this could take the burden off already stretched families, and that this could be a game changer for the PWS community, improving the quality of life. That made us pretty excited to continue going forward. We wanted to underline that we were doing this responsibly because that's utterly important. We've got traceable interactions with the human-in-the-loop pattern that allows us to leverage this emerging technology in a safe way, because we're not trying to replace any of the information, we're trying to augment it so we can multiply the scale of the impact. We have a closed system with trusted context. It can't go out to the rest of the internet. We're leveraging the context that we've fed into it, and we're consistently improving that context. We've got guardrails around diagnosis. This digital assistant is not anything to do with diagnosis, and so we've put guardrails in place to make sure that there never ever comes through a place where that's coming in. We use trusted clinician reviews in the responses, so we're consistently providing an improved data set based on those reviews. And we've got complete traceability. That's something that comes out of the Ligantic platform, is that everything that goes in and out of the system is completely traceable, so you don't have that black box element that comes in with a lot of generative AI. It also is helping to identify context gaps and inconsistencies in some of the information in the data set. So when we had that come through in the traceability, we're able to then do a secondary review on the data that was used and the responses and queries that were coming through from the users. This can help inform potential gaps in research or improve the information that is currently available, because they're going to reduce the inconsistencies. And one that we're really excited about is correction alert notification. Something I heard in a lot of the conversations over the time that we've been here is information changes and it improves. And some of the families were receiving information from clinicians and their medical care specialists that they knew was out of date. This has a built-in functionality so that when we have a better response to something you asked 4 weeks ago, you get an alert that that information has been clinician reviewed and we've got some more information. Or when we identify there's an inconsistency in the information that was driving this and we've improved it, you'll also get an alert. It's so that you're getting proactive updates to the information rather than reactive. We think that this will help and really unlock a lot of information going forward. So what's next? We're continuing to develop out this product and also work with other rare disease communities to make sure that we're able to apply this across the board and everyone gets the scale and impact. We've got some improvements to the UI. We've got some state-of-the-art consent and onboarding flows that we're looking to improve. And we're looking to increase that profile management so you can have that consistent and proactive feedback of the information. Personalisation and language and reading levels to make things more accessible is always important. And those correction alert notifications, we want to make them better and easier to use. We want to also continue to multiply the impact of the clinicians and specialists to improve the human-in-the-loop review improvements and continue to generate those reports and analytics so that we can drive community questions that are driving those research and queries into that. This has been a massively important and enjoyable project for us at Ligantic, so I wanted to say a thank you for inviting us into it and thank you for listening to this. And please come and see us. We'd love to showcase what we've got. We'd love to get your feedback around how we can improve it and make it more useful for you. We'd love to keep this conversation going. So thank you.
Make sure you go and chat to the guys 100%. What I know as a Luddite that works in the software industry, touch and feel is critical to understand really how these things work, and this could be a really big deal. Humans in the loop is a really big deal, and it connects us to our next speaker.